125 million people continue to be exposed to asbestos in the workplace.
So there's a big cost to humans using asbestos in dollars and lives.
Research that goes into these decisions has to be directed by independent, unconflicted scientists.
It's not something that just affects workers, it affects everyone.
Saving one life is great, but saving many more is what I hope to accomplish.
Making a profit off of people's pain and lives is wrong.
We can't quit, not as long as there are hundreds of thousands of people still to be diagnosed.
Ban the asbestos once and for all.
It's a pleasure to be here again for the 15th year. We've come a long way since we started at the National Press Club with about 20 people, but we're here strong today and we're getting stronger. I'd like to start, first of all, by just making a call out to our colleague and friend Barry Robson, who's going to be here. He's sick and recovering in Australia. He's head of the Australian Asbestos Disease Foundation. And we miss you, Barry, but if you're watching on TV, hi, or hey, or whatever they say in Australia. Anyhow, I'd like to start with my slide presentation, if I know how to work this. The green one, I bet. These are pictures I took 49 years ago when I came to the U.S. Public Health Service. These are plants that I went into and took these pictures. I call these my dirty pictures, and they are dirty pictures. This is what asbestos plants looked like in 1970 and 71 in the United States of America. These are pictures that we took of a school in Lander, Wyoming in 1971. We put measuring devices on the children that were going to school. We got readings higher than were allowed in workplaces in the United States. All of that material on the walls is sprayed on asbestos. Look at the slide Marilyn's very familiar with of Ambler, Pennsylvania. The children playing on the piles of asbestos that were left by the companies that abandoned their plants but left their legacy behind. Look at the picture on the bottom right of the children in the schools in California that were using Johns Manville asbestos right out of the bags to make models. That was happening in the United States of America in 1971. We've gotten a little bit better, but we still have a long way to go, and we still have children playing with products that contain asbestos. This is a leftover from a plant in Tyler, Texas. They just dumped their asbestos waste throughout the community. Some of these piles have not all been remediated, but this is what they looked like in 1973. I took this picture. There were houses right next to this with playgrounds and swing sets where children lived. While we're here in the next 2 days, 213 humans, people, not laboratory animals, but people, are going to die of an asbestos-related disease. Linda referred to the fact that around 40,000 people die each year in this country still of an asbestos-related disease. And asbestos is not causing one disease, mesothelioma, which we concentrate on because of the severity of the disease. It's a substance that causes many diseases. Suicide. I did a study back in the 1970s that showed an excess of suicide, and when we looked at those people that committed suicide, most of them had the disease related to asbestos. And as Dr. Selikoff used to describe an asbestos worker, they walk up the stairs backwards. That's because they have to sit on every other step to get their breath. So you can look at this slide and see the diseases, but it's a substance that causes many, many diseases. And we've known this for a long time. It's not something we just learned yesterday. We knew about asbestosis 88 years ago. And these are confirmed epidemiologically 88 years ago. This is Nellie Kershaw, who was one of the first people to be diagnosed in England, who died of an asbestos-related disease, as you can see, at a very young age, from just working in a textile plant making asbestos. Lung cancer we've known for 64 years. Mesothelioma for 55 years. The list goes on. But the point I'm trying to make is that there's no need for our Environmental Protection Agency to waste their time doing more risk assessments. We know asbestos causes disease. It's ludicrous for them to do that. And it's interesting that we live today in an administration where the President of the United States believes windmills cause cancer, but puts his picture on bags of asbestos saying it's safe and one of the best materials ever used. We need to stand up and fight against this. And as they used to say in the space program, Houston, we've got a problem. We need to get over this and get this taken care of. We also suspect there are many other cancers that might be associated with asbestos. I think time will show that many of these are pharynx, stomach, colorectal, esophagus, kidney, lymphomas, multiple myeloma. There's no safe exposure. You've heard this before. You're going to hear it a lot today. In 1976, the agency that I worked for, NIOSH, put out a recommendation to ban asbestos in the workplace. We still haven't done it. Why? And lastly, I want to leave you with the legacy issue. Asbestos is still around. It's in our homes. And as you can see from this slide, there are buildings throughout the United States that still contain asbestos. It was banned for being sprayed on so that schools like I showed you in Lander, Wyoming, don't have walls covered with asbestos anymore, but it's still behind the walls, and it's lurking there, and it still is going to get you. We still have environmental exposures. Linda talked about this a few years ago, about Joplin, Missouri, after the tornado. And I should know Missouri doesn't have hurricanes because I grew up there, but they do have tornadoes. And we have the problem of Libby, which you're going to hear more about from Brad Black and his crew that are here. And asbestos is a legacy that's going to be with us for hundreds of years. It's not going to go away tomorrow. It's not going to go away 25 years from now. It's still going to be around, and we need to be cognizant of that, and we need to make sure that we protect our population from it. Families are affected by asbestos. Just from washing the clothes, we have known this since the 1960s, that women that washed the clothes of their husband that worked in the asbestos factories have died of asbestos-related diseases, mesothelioma, asbestosis. Dr. Molly Newhouse in England showed this when she looked at the families and the households that lived around asbestos plants in the London area. So it's not something that just affects workers, it affects everyone. And we have, as Linda alluded to about the asbestos coming from Russia, we have our pro-asbestos advocates, the Russian asbestos mafia, as I like to call them, who tell us that chrysotile, which makes up 99% of the asbestos used today, is safe. You can breathe it, you can drink it, you can do whatever you want with it, and you're not going to get sick. Well, that's a bunch of bull shit. Anyhow, let me go on and say that the profit-driven frenzy of the asbestos mafia, if you go ahead and blow away the smoke and you look behind the smoke, you're going to find the facts are going to show that all forms of asbestos cause disease. There's no safe exposure, and that industry propaganda is unreliable. And I think David Michaels and others will go into this in more detail, but keep that in mind. And here's a picture of Dr. Selikoff. You can see him on the left with the gray hair, and across is Lyndon Johnson, President of the United States. Dr. Selikoff's in the White House, and he is speaking to change national policy. We got an Occupational Safety and Health Act out of this, and that was great. And finally, a picture of myself and Linda and my son marching with 5,000 other people in Paris to tell the people of the world asbestos is a problem and we need to do something about it. So get off your ass and do something. I'm sorry to cuss, but it's time to do it.